You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me on today's episode of Simple Health Radio. I'm your host, Dr. Emron. Lately in the emergency department, we've been seeing a large increase in people who are coming in with lung symptoms, and several of those people were diagnosed with lung cancer. So I thought on today's episode, I wanted to talk about the history of lung cancer, what causes it, what the different types of lung cancer are, and some of the treatment options that may be available. Now, anytime we talk about cancer, it's a very, very scary topic, and there are people who just hearing that word become very upset. And that's not the intent of the show. This is really just to give you an overview, some of the information. And if you have concerns about it, definitely talk to your doctor. But I don't want you to take any information or the symptoms that I'm describing to you and assume that you have cancer. That's not what we're going to do today. Now, first we have to define what cancer is. So the medical definition is cancer is an uncontrolled growth of abnormal cells. So the uncontrolled growth is the important part because we all have cells that are normal and healthy in the body. For example, skin cells, heart cells, brain cells, muscle cells, and they all divide at some point in time. The division occurs normally, meaning the body recognizes the right time and it'll divide them, it'll multiply them, and then the body stays healthy. Now, every once in a while, when a cell divides, there could be some damage to the DNA because the DNA has to multiply in a special way. If there's any insult or any chemical or any infection that interferes with that, it mutates or it changes the DNA of that cell. Over time, if enough cells are affected, they become abnormal, and then every once in a while, those abnormal cells become unregulated or uncontrolled, and that is what leads to cancer. Okay, so it starts with the DNA, there's some mutation, that mutation causes other changes, and then the uncontrolled growth is the end result, which causes cancer. Now, the common things that cause lung cancer specifically, the number one cause is cigarette smoke. So tobacco is a known carcinogen, which is a chemical that causes cancer. We know that. 100% there's a link with it, but people continue to smoke. There are other environmental factors, for example, asbestos, which has been used in houses and industries to prevent fires, is very toxic and it is linked with lung cancer. And then things like radon and other type of UV radiation. There's several chemical agents that may be in the water, contamination, and then certain parts of the country or in the world do have a higher amount of radioactive material. So these are all linked with different types of cancers. But cigarette smoking is the one thing that people have in their control, and that is linked with lung cancer for sure. Now, there are two types of issues with cancer. So there's the primary site, which means that's where the cancer developed from initially, and then there's the secondary site, which is where it metastasizes, meaning that's where it spreads. So for example, if somebody has lung cancer, we do an x-ray, we see it directly in the lung on the x-ray, that's the primary site. We know that's where it is. However, the lung cancer wants to spread. So it wants to spread in the blood, it wants to spread to surrounding tissues like the heart or the muscle, and it wants to spread all the way out to the brain or the bones. So those are called metastases. We call them METs for short. So you have the primary site, which is where it originally comes from, but that's not where it's going to stay. Especially in advanced disease, it's going to keep on spreading. Okay, so primary site, secondary site is based on the location, and the earlier you locate it, the better the treatment options, because usually that cancer is going to be smaller. It's going to be in one specific area. It's much easier to remove. By the time you have metastasis, there's usually advanced symptoms and diseases. Now, what are some of the symptoms of lung cancer? Well, some of them are very vague. For example, it could be coughing. It could be chest pain, shoulder pain, back pain. It could be a change in the way people talk, meaning their voice is affected. They're very hoarse. They could have some shortness of breath. They could have lung problems like bronchitis and pneumonia constantly. They could also have a lot of phlegm or mucus. And then some people will be coughing up blood. So you can see these are very vague. These are symptoms that a lot of people have with the flu or with pneumonia or with other types of bronchitis or infection. That doesn't mean you have lung cancer, but these are over time. So if these symptoms persist, you definitely need to see a doctor and do the testing to diagnose it. Now, the most common test that people would do would be a chest x-ray. So a chest x-ray is a simple tool. It takes 5 minutes to do a simple x-ray to see if there's any masses that are visible. A CAT scan would be the next option. CAT scan is a three-dimensional way of looking at the same body type, but more deeply and with higher resolution. And that can show other abnormalities. And then there are some genetic tests that can be done if you can find where that mass is coming from. Now, some of the symptoms of lung cancer when it spreads or metastasizes are more severe. So these can include things like blood clots, bleeding, swelling in the face, difficulty walking, broken bones that don't make sense, severe fatigue, and muscle wasting. Now, what is the important thing with that? Well, when cancer cells are multiplying, they need a lot of nutrition and they need a lot of blood flow because they're rapidly doing what they do, which is turnover. They keep on growing more and more. So it's kind of like weeds in your garden. The weeds in the garden grow very rapidly, and they steal the nutrients from the soil. That's the same thing that happens with cancer. Cancer has to feed itself. It requires a larger amount of nutrients like carbohydrates, protein, and so on, and it wants blood. It really does create a chemical reaction to increase veins and arteries in its direction. So that's where coughing up blood can be a sign of cancer. That's where a sign of broken bones, even though there's no injury, is a sign of cancer. Because the cancer is stealing your vitamin D, your calcium, and other nutrients in your legs and your arms, and they break. That's basically what happens. It's a very serious problem. So some people come to the emergency room because they broke their arm, but they didn't fall. They just woke up one day and they couldn't move their arm. When we do an x-ray of the arm, we find some findings that look very abnormal, and those are called pathological fractures. That tells us that we need to look for another source. And oftentimes we'll do a chest x-ray or a CAT scan, and you will see a lung cancer there. So again, the primary site was the lung, but they had no lung symptoms. It was only when they came in for a broken bone that they were diagnosed with the METS, which is the metastasized spreading cancer, and now we have a problem because this person has probably already had it for several months or years, and the infection or the complications due to the cancer are now showing themselves. Now, we mentioned the CAT scan, which is a three-dimensional X-ray. You can also do an MRI or a PET scan. PET scan is a very specialized test. It's only done by specialists. The doctors that typically manage cancer are called oncologists. Many of them are also hematologists. So hematology is a doctor who specializes in the blood, and an oncologist is just a cancer doctor. Oftentimes they'll be both. So it's called hemonc or hematology oncology. So if you ever see that on one of your reports or on a business card or at the hospital and you see a letter that came from the hematology oncology specialist, that's a cancer specialist. Now, a biopsy is a way to actually take a small amount of the tissue from the cancer mass, from that little bundle of abnormal cells, and look at it under a microscope and then do some DNA analysis. And that will tell you exactly what kind of cancer you have. A biopsy of a lung is kind of tricky because you have to actually go into the lung to do it. So usually it'll be done by a pulmonologist, which is a lung specialist, and the test is called bronchoscopy. This is done under anesthesia, under sedation. There's no pain or anything involved with it. The specialist will insert the bronchoscopy tube. It looks like a little camera down into the lung. It'll examine the lung fields, and then if they can find that mass, they'll use a very tiny needle to poke it and then bring up a sample, and that's called a biopsy. So a biopsy gives a lot of information about the mass, and that's how they'll decide which type of treatment will be the most effective. Now, as we mentioned earlier, DNA is the underlying problem, so we have to do genetic testing. So a genetic test would include the molecular profile, also called a mutation profile, and that will look at the tumor cells. So if certain cells are positive and certain cells are negative, that's how the doctors and the specialists are able to identify how likely is this treatment going to be effective, what are the options for future management, and so on. So we really need to know what receptors are positive, which ones are negative, and that's how basically they'll drive the treatment plan. Now, I mentioned earlier that there's different types of lung cancer. So there's broad groups. So the first one is called a small cell lung cancer. So small cell lung cancer is one group of cancers, and then the other ones are non-small cell. So that's basically everything else. So we'll talk about small cell lung cancers and then everything else, okay? Now, the next steps are the typing and staging. So as we talked about, the small cell lung cancer is typically aggressive. That's about 15% of cases in the United States. It is responsive to chemotherapy. However, it can be very aggressive. And so the sooner we find somebody with this type of cancer, the sooner we can begin treatment. So if it's in a limited stage, meaning it's just in the lung or one side of the chest, then we can treat that as such. If it's more extensive, that means it's spread all the way throughout the body, and that's going to cause some major issues for management later on. The other type is the non-small cell. Okay, so these are non-small cell, and they're staged based on their location. Again, so is it in the lungs? That's fine. Has it spread to the lymph node? That means it's worsening. Has it spread outside of the lymph node into the chest or into the middle of the sternum, the ribs, and so on? That's a problem. Or has it spread completely to the liver, to the bones, to the brain? And that's going to be a poor prognosis. That's the metastasis, okay? So there's small cell lung cancer and then non-small cell lung cancer. Now, if the lesion or the cancer is very, very small, surgery is a reasonable option. This is done by a specialist that would go into the lung and cut out that lobe or the section of the lung that has the tumor. This is very invasive. There are some risks with it, so you need to do it at the right time for the right reason. After surgery, there will be an offer of chemotherapy and radiation. So chemotherapy and radiation are two different treatments. Chemotherapy is the injection of a drug that is therapeutic or poisonous, okay? So chemotherapy is a type of poison. Common names for these medications are cisplatin, carboplatin, there's Doxetol, there's Taxol, and many others. So these are very technical names. These are not medications you're going to get at a regular pharmacy. These are handled by the oncologist, and these are all chemotherapy drugs. People who go through chemotherapy, the cells will die with this medication to target the cancer, but also cells that are involved in the skin, in the hair, in the nails, those are also affected. And so people who go through chemotherapy oftentimes will be very, very sick. They have vomiting, weight loss. They feel awful. They feel like they can't get out of bed. They get very depressed. So it's an overwhelming process. And this goes on for weeks, sometimes months. They have to go rounds and rounds of chemotherapy in order to kill the cancer wherever it is, okay? So that's chemotherapy. Radiation is different. Radiation is the use of radioactive waves, such as X-rays, in a high amount, concentrated, almost to burn the cancer wherever it may be. The goal is to shrink it, okay? So chemotherapy and radiation can be used together, along with surgery, to smaller sizes of the cancer tumors. The smaller they are, the more likely they're going to respond to treatment. But over time, there's going to be a point where if nothing is working, then those treatments are not going to be effective, okay? So surgery, chemotherapy, radiation, these are all handled in a team approach at different times for different people. A different option may be presented, okay? So that's the idea with all of that. Then the side effects, as we already talked about, there's issues with blood clots, there's issues with the bones, even dental problems, diarrhea, hair loss. People will have sores in their mouth. They can't eat. They do develop a lot of pain. And they may actually have rashes from these very strong medications because it causes side effects throughout the body. Some are expected, some are unexpected. So the decision to start chemotherapy, radiation, and surgery, it's a very complicated one. And anyone who comes to my ER with any of these types of problems, if I just diagnose them with lung cancer, I always sit down and take a few extra minutes to kind of give them a blueprint, explain what they need to do, and basically their options, because it's overwhelming. It is a life-changing decision. We want those people to do well long-term, but we have to be honest with them. Some cancers will get better very quickly. Others, when they go into remission, they could come back, and some simply don't improve. And those people will be offered palliative care or hospice care. That's basically for symptom control, even though the infections or the complications from the cancer are spreading. So those people are going to die from their cancer, and there's no cure for it. The most we can do is make them comfortable. We give them oxygen. We might give them inhalers or steroids. We might offer them assistance like psychologists or psychiatrists. We give them pain medication. We help them to basically create an end-of-life plan for them because we want people to die a reasonable, dignitary type of a death. We want them to be able to enjoy the things they want with their children and their grandchildren and to do the things that they always wanted to finish, kind of like a bucket list. So again, the treatment is really based on the individual and is really based on what they want to do at that point in their lives. So we try to detect it as early as possible and then offer treatment based on that. So I hope you learned a little bit about lung cancer and some of the very technical, very detailed treatment plans that are available. If you or a family member is struggling with lung cancer, I always advise you to please talk to your doctor. They will give you some referrals to a good list of resources that may include a social worker, psychologist, support groups with other people who've gone through lung cancer and their families, and it really does make a big difference. If there's questions I can answer, please put them on our Twitter page. I'm always happy to respond and provide general knowledge about that as well. So I hope you learned a little bit about lung cancer and you'll share this with your family and friends, and I look forward to having you back on a future episode.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3 and Out Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions.